On behalf of the Patient Safety Authority, I'd like to welcome you to the Rapid Learning web conference titled Tracking Ambulatory Surgical Facility Cancellations and Transfers. My name is Jeff Bomboy, and I will be the moderator for this program. Today's web conference is 30 minutes, including question and answer, and will be recorded. The recording will be available in a few weeks on the Patient Safety Authority website. If you accidentally exit the webinar, you can log back into the meeting from your internet browser. If you're having a problem logging into the webinar, please contact Authority support staff using the contact information listed on your registration confirmation materials. At the completion of the webinar, we would appreciate you taking time to complete a post-evaluation. This is very beneficial to us. Upon completing the evaluation, a link to a certificate of attendance is provided. You must complete the evaluation all the way through to the last question, after which the link will be provided. Today we will be using the Q&A box for questions. If at any time during the presentation you have a question, type them in the Q&A box found on the right-hand side of your screen. We will try to answer as many questions as we can at the end of the webinar. Now I'd like to introduce the speaker for today's webinar. Leanne Gardner is a Senior Patient Safety Analyst with the Authority and the developer of the ASF tracking tools. Dr. Gardner is a nurse who has a PhD in health services research. She has more than 20 years of research experience, with the last 4 years focused on patient safety. Leanne and I worked on an ambulatory surgical facility preoperative screening collaboration project with 11 ASFs in the Northeast region of Pennsylvania. The goal of the collaboration was to reduce the day of surgery cancellations and transfers. At the end of the collaboration, the participating ASFs requested a way to continue tracking day of surgery cancellation and transfers. An ASF tracking tool was developed and is the focus of today's webinar. The results from the collaboration and the development of the tracking tool are found in March 2014 and September 2014 advisory. These articles are available online for free. Today's webinar is a live demonstration of the tracking tool. There is a set of slides accompanying the webinar. If you have a copy of the tracking tool, you may want to open it to follow along with the live demonstration. For those who do not have a copy of the ASF tracking tool, it can be downloaded from the Authority's website. Please click on the Educational Tools link and click on the ASF Preoperative Screening Assessment link. An ASF tracking tool link will appear. There are 3 ASF tracking tools: General Services, Ophthalmology, and Endoscopy. Download the one that best fits your type of ASF. Now I will turn the program over to my colleague, Leanne Gardner, to tell you how to use the ASF tracking tool and how to interpret the information. Leanne?
Thank you, Jeff. I'm going to start by covering 3 learning objectives for today's webinar. The first one is to identify safety concerns with day of surgery cancellations and transfers. We're going to learn how to illustrate how to use the standardized ASF tracking tool to identify circumstances surrounding day of surgery cancellations and transfers. And finally, we will plan how to use the cost calculator and to use and calculate costs associated with day of surgery cancellations. What I'm going to do today is just go through slides 4, 5, and 6, and then we will move into the demonstration of the tracking tool. But before we do, I wanted to cover a few of the overriding ideas behind this tracking tool. So the tracking tool functions monitor and provide trends with automated reports for day of surgery cancellation and transfer rates. It also provides automated reports for day of surgery cancellation and transfer details and event information. The tracking tool also builds a business case by identifying costs associated with day of surgery cancellations and cost savings associated with reducing those cancellations. Now, in the tracking tool, when you will see it today, or if you have already downloaded it, there are 7 separate spreadsheets. They are in this order in the actual tracking tool. So when you open it, you will see a day of surgery cancellation cost calculator. You will then have on the second spreadsheet cancellation rates, followed by a spreadsheet with transfer rates. Then you have the cancellation event information, followed by the reports. You have transfer event information and transfer reports. Now, these slides do have data in it, but the data presented in these slides and in this demonstration are fictitious. They do not represent any actual facility data. So before we proceed, I wanted to talk about the tracking tool itself. As Jeff had said, there are 3 different types of Excel workbooks. There's one for general services, there's an endoscopic-related tracking tool, and an ophthalmologic. So depending on what type of focus your ASF uses would determine which tracking tool you would download. All 3 tracking tools have the same spreadsheets. The only difference is the types of procedures that are embedded within the tracking tool. The tracking tool is free, and it's a download from the Pennsylvania Patient Safety Authority webpage. And we have provided the link for you in this slide. But what we also want to show you today is where you can actually get it. So what I have in front of me is the authority's webpage. You go here, and as you can see on the left-hand side, second from the bottom, there is a link that says Educational Tools. When you go over there and click on it, it will bring up the Patient Safety Tools webpage. In this page, there are a lot of different web tools. The ASF tracking tool is located here where the hand is on the ASF Patient Screening and Assessment link. When you open this link, there are several different choices under Prevention Program Tools. The tracking tool is to the lower right-hand side. When you click on it, what you will see, there is a reference guide and then the 3 different types of tracking tools. For today's demonstration, I'm going to use the General Surgical ASF. You can download this at any time. So now what I want to do is go actually into the demonstration of the tracking tool itself. When you open it, what you will see is this first spreadsheet, which is the day of surgery cancellation cost calculator. Now, when you look at the slides and the handout that I gave you, you will not see all of these specific items, but I will refer to some of the slides just so that if you want to take notes, if you don't have the tracking tool downloaded on your computer. So we're going to start with slide 8 where it says tracking tool. The first thing you need to do when using it is to actually enter in the initial date. When you enter in a date, you will see the blue box up here on the upper left-hand corner. You enter it in for the first day of a month. So in this case, you would enter in, and I'm going to follow what we have in the slides, July 1st, 2014. Now, by doing that, what happens, if you notice at the top where it says workbook time period, you see it now reads July 14th through June 2015. The benefit of this tracking tool is that you can use it year after year. So when you're done using it for a year, you can then go and download it again and start for collecting for a second year. So after you're done putting the date in, and when you put the date in on this first point, it actually fills in the dates for all the 6 remaining spreadsheets, and we'll see that as we go through the tracking tool. What I want to do right now is look at the actual cost calculator ASF data, and that is, the screenshot is on slide 10. What that does, what this calculator does, is it helps build a business case by entering in cancellation rate information. You enter in the cost of a cancellation. It also calculates procedural costs and also physician costs. And it then provides reductions in savings when you start to reduce the cancellations. So for our demonstration purposes, we're going to enter in the number 425. So we're going to say that we had 425 day of surgery completed procedures within a month time, and that's the time frame I'm using. You can use any time frame, but for our purposes, it'll be for a month. So in this month, we had 10 day of surgery cancellations. Now you'll notice once I enter in those 2 dates, you can see that it automatically then calculates what your day of surgery cancellation rate is for this particular time period. Now under the facility level cost calculation, we're going to plug in the number 503 and say that the average cost of those 10 cancellations were $503. That is the facility's cost. We also provide an opportunity to add in physician level costs that may be associated with a cancellation. For our purposes, for example, we're going to say $325 per cancellation. Again, if you look underneath the total facility level cost of cancellations, you see that those 10 now result in $5,030 lost in revenue brought in due to those cancellations. And the physician cost is $32.50. Now, if you go a little bit further down, when you scroll down on the cost calculator, and you'll see this screenshot in slide 11, you can see what the potential cost savings are by decreasing your day of surgery cancellations. So in the far left-hand column, you see that there are currently 10 cancellations. It lists the rate, and when it says lost revenue, what that does is that will calculate and sum up the facility and the physician level cost. If you want to see just one versus the other, you just don't enter anything in for one of those points. For the current column, its additional revenue is 0 because you are accounting for all those cancellations. But then you can see that for the next 6 columns, it shows what the difference is in the lost revenue versus additional revenue based on a 10% fewer number of cancellations, a 25% fewer number of cancellations, 50, and so on. So essentially, it looks like a reverse order. So when you look at 10% and you have 9 cancellations, you're going to actually have an additional revenue of $828. Now, if you look at the far right side, where if you were to say fortunate to have no cancellations, you would then see the reverse, that there is no lost revenue, and you now have an additional revenue of $8,280. Right below this screen with the potential cost savings, we have included some procedural reimbursements. Now, these reimbursements were identified from the Pennsylvania Healthcare Cost Containment Council website. So these were just figures that we had pulled up in 2013. If you're looking for cost figures, you probably would be, it might be advisable to go to your finance folks to find out exactly what the costs are. But these numbers down here were for procedures that we were able to identify during the collaboration. So that is the cost calculator. So I want to move on to the next spreadsheet. On the bottom, you can see it says cancellation rates. And when you download this on your screen and in your computer, you will see that anything associated with cancellations has a red color to the tab on the spreadsheet. The transfers have a blue, so it helps also kind of keep that in mind, what you're looking at. In this cost cancellation rates tab, what we have here are 3 different spreadsheets. Right now, what you're seeing is the top of the spreadsheet. It shows that it's the day of surgery cancellation rate. Now, if you notice, in this particular table, we start with July 2014. If we go back to the cost calculator, we can see when we go up to the top where we entered in that number, that date, what it did is it filled in all these dates for this particular year. I've included some data just so that you can see what the trend line looks like when you get data in there. Now, when we add a cancellation in there, and I'm going to put 8 cancellations, and I'm going to say for this particular month we had 472 completed procedures. If you watch the trend line when I hit enter, you will see that it automatically will calculate and provide the current month of April 2015 with that cancellation rate. The other nice thing with the table is it provides what your average cancellation rate is at the current time. Now, if you scroll down, there is also a table and a trend line for 24-hour cancellation rates and 48-hour cancellation rates if you feel the need to want to track those two. We did do that during the collaboration, and that's why this is part of this tracking tool. The next spreadsheet tab is for transfer rates. This functions the same way that the cancellation rate is. So if we were to add in a number of transfers and put in the number of admissions, and that's the big difference between the transfer rate and the cancellation rate. Transfer rate looks at admissions. You would then also get that immediate result for what your transfer rate is for the month. The next tab I'm going to look at is what we're calling the day of surgery cancellation information. This is the information that you will collect about the cancellations that will provide automated reports. I want to stop for a minute before we even go into about entering data and to actually see this in a smaller screenshot. We're on slide 15. When you look at this when you come in, you will see at the top there are the different months that are listed up here. Those, again, get filled in when you put your date in on the cost calculator. Each month has its own separate section. It lists the patient event number, date, time of preoperative screening, and when we're talking about time of preoperative screening, we're talking about the nurse-based preoperative screening, the type of procedure that was canceled, and the cancellation type. Where it says overview and general comments, those are free text fields. The date of the event and the last two fields, the overview and general comments, do not impact the automated reports. You do, however, it is essential to enter in a patient event number, whether you enter in 1, 2, 3, if you want to use medical record numbers, it's up to you. So when you look at these, I want to show you what happens when you go to a month. So we're going to use August as an example. When you click on it, it has a hyperlink, so it will bring you right down to that month. So when you want to get and enter in data, and I will show you, you put in the patient event number, the time of pre-op screening, and we have the selections based on day of surgery, 24 hours, 48, greater than 48 hours. We also have if you did not pre-op screen the patient or if you were unable to contact. So when you put in and click on one of those choices in there, it will fill in that box. Same thing for the type of procedures. We have a whole list of procedures, and I'll talk to you about where you can find that full list ahead of time, but we'll choose cataract for right now, and then we'll look at the cancellation types. There are 7 types of cancellations, and you will find the list of those on slide 16. These were cancellation types that we felt that during the collaboration, these were amenable to implementing a nursing-based preoperative screening and assessment. So I'm going to choose protocol issues. Now, when you're done entering in this information, if you click on the cancellation reports and go to August, there's the information we just entered in. You can see there was one patient at the bottom of the sheet with a preoperative screening greater than 48 hours, and that the cancellation was a protocol issue, and because of the way it's color-coded, it shows for cataracts. So I just want to go back for a minute to the cancellation information. We entered in data just so that you could see what happens when you have multiple cancellations entered in. The spreadsheet on that would look like this. when you have multiple. Again, at the bottom of the spreadsheet and the reports, you can see how many patients. I'm not going to discuss the transfer information and reports too much because they basically function the same way. The bigger issue with the transfer is there are 3 additional data fields. We have the age of the patient, body mass index, and the patient's ASA class of physical functioning. With the reports, they function the same as the cancellation, but now you have 3 different additional reports on age, BMI, and then the ASA class. The biggest difference with the transfers is we do distinguish between a preoperative and a postoperative transfer. So essentially, that is how the tracking tool works. Before I move on any further, I did want to at least talk for a minute about the reference guide. We did develop this reference guide, which is on the page on the website, on the authority's website, where the tracking tools are. This reference guide provides all the details about how to use this tracking tool, and in addition to providing that information, I wanted to point out 2 pages. One is page 5, which I am scrolling down to right now. This is where the different types of cancellations are and the descriptions for what we felt made up a protocol issue or a preoperative instruction. The last one is page 10, and on page 10, we have cancellation event types. We provided narratives, again, fictitious, what types of factors to consider, what type of a cancellation event type, and the rationale for why we used it. So now I will hand the presentation back to you, Jeff, for some questions and answers and closing comments about resources available to ASF healthcare staff. Jeff?
Thank you, Leanne. That was a great presentation with valuable information everyone can utilize in their organization. That concludes our slides presentation portion of the program. Now we would like to begin our question and answer period. If you have questions, please type them in the Q&A box found on the right-hand side panel of your screen, and we will try to answer as many questions as we have. As we are waiting for questions, we've already received some questions from some of our listeners, so let's start with those. Leanne, I am entering all of my cancellations, day of surgery, 24-hour and 48-hour cancellations for the month, and have more than 35 cancellations. Is there a way I can add more lines to the tracking tool?
Well, that's a very good question. The cancellation event information really is intended to collect day of surgery cancellation information only. The tracking tool has automated cancellation reports, and if you, when you look at it, you will see that the title on those reports do say day of surgery cancellations. The reports, however, and the data fields are locked so that titles of the automated reports, the number of cancellation lines per month, 35 lines, and the choices in the data fields are unable to be altered. So if you choose to collect data for all your cancellations that occur in a month, whether it be day of surgery, 24-hour, and 48, you will want to make a note in the cancellation event information spreadsheet. So like in those free text fields, you can say that it's not a day of surgery cancellation, if that's what you're wanting to track. But you would also need to somehow make a note on the automated reports to remind yourself about what types of cancellations are actually in that report.
Thanks, Leanne. We have another question. When I try to print out reports, I receive many pages of printed reports. How do I print out specific types of reports?
Again, another good question. This was one that I had to kind of work at a little bit. We had used Excel 2013, and when we clicked on the file link at the top of the Excel workbook and clicked on print, what you see in there, it says print active sheets, and there's a box under those settings, and it'll tell you which pages you want to go to. Now, the nice thing is when you pull up the print function, there are arrows, so it'll show you which pages. So as long as you can go and insert those page number reports in the 2 boxes, you will be able to get just that to print up.
Okay, thank you. Just a reminder that this webinar is being recorded, and it will be posted on our website in a few weeks. So if you want to re-listen to this. We have one other question. I want to collect data for patients who cancel because they have called in sick on the day of surgery. How do I enter in that data?
Well, during the ASF collaboration, data about patients calling in sick on the day of surgery was collected. However, the tracking tool was developed to track only those situations and circumstances that were deemed amenable to the implementation of a nurse-based preoperative screening and assessment. Changes in patients' health status, such as a patient waking up sick on the morning of surgery, is one of those situations we found in the collaboration that was not amenable to a nursing-based preoperative screening and assessment, so it was not included in the tracking tool.
Thanks, Leanne. Just a reminder, if you have a question, please enter in our Q&A box. The webinar will soon be ending, but I'll be glad to take a few more questions if we have more. At this time, I have no more questions. I want to thank everyone for joining us today. To receive and complete the evaluation, you must click on the Leave Event button after the question and answer period. The post-evaluation will pop in a new window. At the end of the post-evaluation, there is a link in the last question to copy and paste into a new internet browser window to secure the certificate of attendance. If you have experienced technical difficulties with this webinar, or if you have a question, please contact the help desk at 717-346-0469. The recording of this webinar, once again, will be available on the Patient Safety Authority website in a few weeks. As a reminder, when you click on Leave Event, please complete the post-evaluation survey to receive a certificate of attendance by copying the link at the end of the evaluation into your internet browser. We still have no further questions, so this will conclude our webinar. Thank you all for attending. We look forward to hearing from you if you have any questions. You can see the links on the page how to contact Leanne and I. Thank you and good afternoon.